difficult times amid COVID-19 have once again reminded us about the contributions and sacrifices made by doctors and the healthcare staff around the globe. This year is once again dedicated to all those doctors and healthcare professionals who are serving in these trying times by risking their lives either in primary as well as secondary care setups or in dedicated COVID care facilities. But did anyone think of the mental trauma the doctors go through in these tough times also? In honor of this Nobel profession, this Doctors' Day, we are celebrating doctors and how doctors' mental health is equally important. We have with us Dr. Sameer Malhotra, who's a senior psychiatrist, director, mental health and behavioral sciences at Max Hospitals. Welcome, doctor. It's good to have you at India.com and the health site. So, doctor, I would want to understand, in these times, what are the challenges that the doctors are facing on a day-to-day basis in the pandemic?
Seeing large number of patients who are coming with infection and with the family members going through a lot of stress, dealing with both patients as well as the suffering families. And the second wave of the pandemic has really hit people very badly in the sense many families got affected. It wasn't just one individual in the family, it was the entire family which was getting affected. At times, people lost their family members to the COVID infection. So going through that every day, day in, day out, the frontline workers, whether these were doctors or nursing staff, went through a lot of stress and trauma. Plus, there were limited number of beds which were available, isn't it? And many a times, many hospitals could not entertain the number of patients who were approaching them. So that helplessness was also seeping in, where obviously doctors couldn't create beds overnight, they couldn't create the facilities overnight. So that kind of pressure on the mind of the doctors, on the mind of the caretakers was definitely taking a toll, both physically as well as emotionally. And because they were long working hours, their sleep-wake cycle was getting disturbed as well. They were also missing their own family members because at times the first-line workers had to be quarantined after having worked for a fixed number of hours. So missing their family, at the same time working constantly, supporting the PPE equipment for long hours at that point of time, and the added helplessness of not being able to help all those who were suffering at that point of time, and at times, despite the best of their efforts and despite best of the medical facilities, they could not revive some. Now, all that put together does take a toll on the health.
Right, doctor. So, some certain situations are very adverse where they see the patient sinking in and all of that. So that also takes a toll on them mentally also. And the long hours, the PPE kits that are there, but the emotional trauma that they go through also affects them mentally. So whenever we talk about mental health, and especially in these days, we've been talking about mental health a lot. And whenever we talk about it, the first thing that comes is to take therapy and go to a doctor. But doctors are also human beings. So even their mental health is at stake in wake of the pandemic. So what do you have to say on that?
Thank you for raising this very important and sensitive question. Doctors are also human beings and they're also emotional beings. So on one hand, they were trying to put in their best possible. At times, they were not able to cater to every individual need because obviously they have human limitations. There were limited kind of bed facilities which were available. So not every patient could have been treated at home. So at times they had to stretch their services and connect to patients at their home settings also. So even their virtual consultation hours had increased apart from their physical consulting hours. And at times, this is very painful reality, but many times when you are not able to revive a life, despite the best of your efforts, at times out of that frustration, the family also takes all its wrath on the service provider. That is a very painful reality. Alongside what doctors also went through was disturbed sleep-wake schedule because of long stretched working hours and the stressful work that they were doing all this time. All that put together definitely disturbs you emotionally. So I've known, and because we are in this discipline of catering to the mental health needs, many doctors, many nurses, many paraprofessionals have approached us. So all that put together does
Takes a toll.
influence
Yes,
emotional health. Yes.
doctor, you just touched upon a point which I was just going to ask was that do doctors or frontline workers approach you or other doctors for therapy or something? Because they also have families at risk. So whenever they go out, they are not only risking themselves, they're risking the families also at home. So any such an incident, has it ever happened?
Yes, I mean, some doctors and some nurses did approach us, and this did happen because they had long working hours. They were away from home. Then they had to go through the quarantine period, and they were away from their family. Plus, this added guilt or this added anxiety: what if we pass on the infection to our family member?
Right.
So, on one hand, it was difficult work. It was seeing people in that terminal state of illness, at times trying to revive them. So it was that difficult physically and emotionally, at the same time missing their family and having this fear of what if we pass it on to our family. So all that put together did influence their emotional health, and some of them did approach us with significant sadness or depressive symptoms and significant anxiety and insomnia, where they were not able to sleep very well. So those were the kind of issues which were raised as a part of our duty towards this profession. We are also taking care of the mental health needs of professionals and paraprofessionals working in this field and who were dedicated to COVID, providing COVID services to patients. As a helpline, we did start a helpline through Max Healthcare.
That's a great initiative by Max, because certain helpline numbers are there for other things, but a special helpline number for the doctors themselves, for their mental state and mental health well-being, was a very good initiative. And I think this should carry on, because we're still not over with the pandemic and we're still fighting at it. Doctor, I also wanted to know that you are a doctor yourself, so any personal circumstance that you would want to share, that if you would step out of the home to see a patient or something, then what goes into your mind when do you think about your family of infecting them? So could you share your personal instance with us?
Yes, I mean, there are many such instances, but if we are following the COVID appropriate behavior, where we are maintaining some physical distance, where we are, kind of using mask, and these days double masking is being recommended. If we are supporting the PPE equipment, if we are going very close to a patient who's infected with COVID, if we are, using the sanitizer as being recommended, and if we are washing our hands, as required, then perhaps we are able to somewhat prevent ourselves from getting infected. At the same time, also one should go for vaccination in time, because there are many myths surrounding vaccination. But I think as of now, it is important for us to consider vaccination for self protection. Most of the doctors have gone through the vaccination process. Uh, yes, we do counsel ourselves, but we also need to understand and be aware, in which most of the doctors, and rather all the doctors, are usually aware of, is their responsibility towards the larger society.
Right.
And we do see the patient not just as an individual, but we also try and place ourselves in the shoes of the patient. So one has to understand that, and more so when we are catering to the mental health needs of that individual, to be able to provide our best possible services in an effective and meaningful manner.
Right, doctor. So, do you want to give any tips to the doctors or the frontline workers as to how they can balance their mental health if they're feeling anxious or any such situation?
I think most of the times doctors, paramedical professionals, they tend to neglect their own health, because they are so very concerned about maybe the health of their patients, health of the sufferers, health of family members around, friends around them. At times, they tend to neglect their own health. So please do not neglect your own health. Please take out time to follow a regular sleep wake cycle as much as possible. There could be difficult times when you are called at night, when the emergency duties, but do try to maintain a good sleep wake schedule. Do exercise somewhat regularly, and please do engage in some hobby which you find meaningful, which you enjoy doing, and do interact with family, with friends. Don't isolate yourself, because you are facing a lot of stress, both physically as well as emotionally, when it comes to catering to a large number of population who has been suffering with this pandemic. So do take care of yourself, because you are important. You are quite precious, not only to yourself, but to your family, to the society at large.
Right, doctor, as you pointed out that, doctors should take care of the mental health because they're very precious, not only to them, to their families, but to the nation at large. And that is what we want to celebrate this Doctor's Day. And thank you so much for taking out time for India.com and the health site. And anything else you would want to add on?
I would just like to say that family members of sufferers should also realize that doctors are human beings and they try to stretch themselves, and no doctor wants his or patient not to receive the best of care. So please do not use physical or emotionally abusive, words, or do not insult the doctors, because they have been overwhelmed physically and emotionally. They have been trying to do their best possible. They need to cooperate. Family members need to cooperate at that point of time rather than taking out their wrath on the doctors. Many times there could be miscommunications which need to be sorted in a calmer frame of mind. And as a society, we need to work together. And my salutations to all the doctors, to all the nursing professionals, all the paramedical professionals, and all the frontline workers who have been putting in their best possible, risking their own lives, trying to help bring back and revive life to the best possible that they could.
Thank you once again, doctor. It was a pleasure speaking with you.